It's great to see the public support that we have here today, people going past, honking their horns. I believe that people understand that the health service needs people who work in it, and that's what this is really about. What the government need to face up to is the fact that if you're cutting jobs, you're cutting services. That's what members are telling us right across the health service. And the people who suffer are the patients, the clients, the people who are desperately in need of services.
So I'm here to support Fórsa in their efforts to engage with the HSE about the current staffing situation. It's having a significant impact on mainly our waiting lists in terms of how quickly we can see patients, and that then has an impact on the treatment they receive. I think it also has a huge effect on general staff morale and the sort of ability of staff to progress in their careers within the HSE as well.
Let's cut through the spin. A pay and numbers strategy is a recruitment embargo by another name, and if you're cutting jobs, you're cutting services. What the HSE did at the end of last year was effectively do away with thousands of posts, and our members in Fórsa and the other unions are the ones who are suffering now as a result of that, and that's why today is a protest, but why we'll commence an industrial action ballot on the 14th of October. Services are suffering, patients are suffering, clients are suffering, and our members are not prepared to stand for that. And what we're seeing is the HSE in a very unstructured, uncoordinated way mismanaging the health sector.
Obviously in audiology it's very important for especially children to be seen as soon as possible if there are hearing concerns, and so if there is a delay in the assessment or the identification of a problem and then in the treatment of it, that can have a significant impact on their speech and language development, their learning abilities, academic and social aspects as well. Services are suffering.